First this morning, we continue our focus on the hospice story. Traditionally, people envision hospice care taking place in a patient's home as they make their final journey in life. But sometimes the care must be given on an inpatient basis. And here to discuss the facets of hospice care, Dr. Jennifer Hirsch, the medical director for Wexner Heritage Village and Zusman Community Hospice, also registered nurse Marian Fahrenholz, and Seymour Reyes, whose wife was given care through Zusman. And it is a pleasure to have all of you join me as we continue our discussion on hospice. And Marian, let me ask you first, for those who don't know about what Zusman is, what is it? Describe it, and describe what that in-care is as opposed to in a patient's home for hospice.
Of course. Zusman House is a 5-bed inpatient hospice unit. It's located on the campus of Wexner Heritage Village near Bexley. And our patients come to us from hospitals, from nursing homes, and from their own homes when they're in need of inpatient hospice services that can't be provided in the home. And our team of hospice professionals works together to provide the highest quality of care in a setting that's designed to be as home-like as possible. All of the rooms are private, and the goal is to just have families at the bedside. Families are always welcome.
How long, doctor, can someone be at Zusman House? What's the average stay?
The average stay is a little less than a week, but people can stay at Zusman House really for as long as they need our services. For the most part, patients come into the inpatient unit when we've reached a level of medical care or a need for medical care that's a little more challenging for families to provide at home. And what coming into Zusman House then I think allows is that family can play the role that only they can, which is husband or child or parent, and then we can take over the medical care.
Mm-hmm. That's interesting that you say that, because families many times do not have a doctor or nurse, Marian, who is there, who can assist, and learning to do all these important things as we draw to the end of life can be very difficult for people.
It can be difficult, and there are common symptoms that will generally arise at the end of life, and we're specialized in that, and we can take care of those and allow the patient to be as comfortable, as peaceful as possible while they're surrounded by their loved ones.
Well, Seymour, your wife passed away. She was in hospice there, and I know for you, you told me it really was a wonderful family experience, if it can be such a thing.
It was indeed, and in fact, I was kind of part of this continuum you heard. They being Zusman, provided the home care, and then when it reached the point where obviously that was no longer viable, she just moved almost seamlessly into the inpatient unit, and it was way beyond what I, who was, like most people, not familiar with the range of services and, frankly, the environment that is provided by these places. I simply could not have managed without them. And beyond that, it was the best thing for my wife, not just for me and for my family, and that's obviously priority number one.
What surprised you the most? As we've been talking about hospice, I think some people are under the illusion that it is a sad environment, when come to find out that really isn't always like that.
Example, several. Physically, they have a refrigerator in the room where we can keep the food that the patient likes. If that's not sufficient, they have a huge freezer out in the corridor, similarly, and we could keep, in this case, we were able to keep my wife's bagels and things that she appreciated. Another example, to show you how flexible they are and how it's kind of like a family, my granddaughter plays the cello, and once she came in with a piano player, a friend of hers, and they gave an impromptu concert in one of the rooms that they have there. And not only was it for my wife, but soon all the other patients were wheeled in. And it is a family. This is not a sterile place. Hospice, even despite the name, is not hospital. It's entirely different.
It's more hospitable.
Exactly. Good way to put it.
Dr. Hirsch, what would you say to folks who may be on that line then about whether or not they should start hospice care at home, go right to a facility? What are some decisions that families have to make regarding this?
I think we need to look at what the needs are of the individual who's entering into the hospice program and what are the layers of care that they need at home. So sometimes we just need what we call custodial care, people to be by our side, take care of our basic needs, and sometimes we need more medical care. It's not a decision that someone has to make on their own. Our entire team can come to the house or hospital. It's a discussion, and I think that's the key part of hospice. It's always a discussion. We're always flexible, and any plan we make today we can change that 6 hours from now or tomorrow or the day after.
And Mary Ann, do you see that as being very important, that each family is different, each patient is different, you adjust to their needs?
Absolutely. That's one of the best things about hospice, is that the care is individualized for each patient and each family, and we can meet those needs, whatever they may be, and the needs are often changing, and we're able to meet those needs as that changes.
Well, thank you again for being on the show, discussing this. Seymour, thank you for sharing your experience with us.